and welcome back. For those of you that this is a first time for you, we're thrilled to have you. I'm Vicki Dennis. I'm the Associate Vice President for the O'Donnell Brain Institute. Anupa and I work together on the Total Care Program, and we are really thrilled to be able to do this afternoon. Through our Patient Family Advisory Council, some of who our members are here, you all said one of the things that we really need to focus on is patient education. And so this was an opportunity for us to do some more of that. I want to tell you a story as we kick this off this afternoon. Back in COVID, in the days of COVID, our COO of the hospital sent out an email to the leadership team, and he said, we really need help in the kitchen at the hospital. And so if anybody can do shifts in the hospital, please let us know. So I signed up to do a shift in the hospital, in the kitchen. I'd never been in a hospital kitchen before in my life. I don't even like going in my own kitchen very much, truth be told. And so, I've been a patient and I've had food delivered, and I obviously have eaten in the cafeterias here, great food. But working in the kitchen was a whole new experience for me. And the folks that do food and nutrition for patients and families are one of those unsung hero groups. It's like the people who do your laundry and clean your patient rooms. It's not really glamorous, but then you think about what would happen if you didn't have them. And I saw the detail that goes in to putting together a tray for a patient who is diabetic or who has food allergies or who can't swallow or needs certain kinds. And I was amazed, and I was scared to death, honestly, that I was going to put the wrong thing on the wrong tray and somebody was going to be compromised. I mean, it was really scary. So I wanted to give a special shout out today to two teams, Todd Ichinaga and his team, Tad Campbell and his team. I stand right in front of you. That's really helpful. These folks are auxiliary services and food and nutrition sciences. These are the teams who make the food service work and who train the dietitians and folks to put those meals together. So thank you. Thank you. Because without that, we wouldn't do something like this. We've got a great agenda for you today. I've got a couple just housekeeping. When you came in, you had a chance to pick up a couple of handouts. One of them is the slide presentation that's going to be shared. So if you didn't get that, stop by the table. Give you a couple. Got one? Need one? Okay. Yep. Anybody else need one while I talk into my hand? So that is one. We've got another handout here that talks a little bit about feeding and food utensils. So if anyone needs that, we've got that as well. And then we've got, while I'm doing this, I also want to let you know that this would not be possible without the donors. Dallas is very fortunate to have a huge philanthropic community. We have donors who have given generously to launch the Total Care Program. And so for those of you who may have done some of that contribution, we're deeply appreciative. If not, please know that that's what makes this program work. And so we've just been really blessed with this and continue to be blessed. Finally, the thing that's probably most important, other than the thank yous to the folks who put this together, we have a feedback form It's very important for us to get your feedback as we build this program, because we really do want to do what's important to y'all. We were very clear when we started this to say that this was going to be patient driven. And so if there are things that are important to you that we can do more of, we would like to know that. We would also like to know feedback specifically on this event. This was a new thing for us. We've never really done anything like this. So if it was helpful, we'd love to know that so we can continue to do that. And with that, I'm going to step down and let the cooking begin.
Okay. All right. I'm Tad Campbell, and I am an assistant professor here at UT Southwestern in the Master of Clinical Nutrition program. And I also see patients in a couple of clinics here on campus, as well as Texas Neurology overall from Central. And so this is Alexis Vasquez. She is one of our students. She's a second-year Master of Clinical Nutrition student. She's sliding into her second year. This is summertime, but we're going to round on up and call it second year. She's actually very interested in neurology and has come to clinic with me, 4 times now or so, and has another couple of times scheduled. So she's doing that on her own. This is also extra for her. She's not getting credit for it, but that's her level of interest. So first of all, today, Alexis is going to go through, and give an overview of nutrition in general, nutrition as it pertains to Parkinson's disease more specifically. What we'll do is cover a lot of nutritional concerns that come up with Parkinson's, maybe things that I'm sure you've thought of them, that a lot of people don't think of, but just concerns, things that maybe physical deficits cause. And then next we'll move into the food demonstration. We've got 3 things that we're going to be feeding you today. One is an egg muffin, one is an avocado mousse, and the other is a berry smoothie. And so I'm going to try to work into this conversation why these recipes were chosen when we get to them. And then we'll also, at some point at the end of this, near the end of her presentation, I will walk you through some of these adaptive devices down here. And whenever it's time to eat, when we're done talking, if you want to come up and get your hands on them and do stuff with them, try them out, that's perfectly fine. And there will be ample time for questions at the end, I'm sure. Oops. Oh, can you hear me? All right. So among the concerns that Alexis will talk about today, we'll be talking about protein intake. There's a couple of angles and things we need to think about with protein. She'll describe those. The importance of your fluid intake and its role in constipation prevention, as well as I'm going to take some time to talk about a few nutritional supplements that are popular, and as well as, some that are popular, and then only those that have evidence for them. And then Alexis will continue on with discussion around independent eating, what we can tell you about dysphagia or problem swallowing. And then early satiety is another thing that we get concerned about with Parkinson's, and she'll discuss that. And finally, weight maintenance. We'll wrap up with that. In weight maintenance, there will be, it's hard to say. Sometimes people need to gain weight. Sometimes people need to lose weight. But in all cases, we need to do something with that, and we'll help you with it. So I will let Alexis jump in and go.
All right, so some of the first common concerns that we're going to discuss today, first is protein intake. So whenever a patient with Parkinson's disease comes in, we definitely want to approach it with the provider, but also the registered dietitian to provide a more individual approach. So the dietitian will be able, in coordination with your provider, to give you specific recommendations as far as energy, protein, fat intake, and things of that nature. So combining them 2 together will definitely help with patient outcomes. That's our goal. Also, additionally, with protein needs, just the general recommendations are 0.8 grams per kilogram. And so with Parkinson's disease and also medications, which I'll discuss a little bit further on, protein intake is kind of, I guess, a touchy subject as far as how much we need, but we also want to limit to prevent any absorption decreases. But we also want to make sure that protein, we're getting that in so that we're maintaining our muscles and not losing any future weight. And then also the timing of the protein throughout our day. in coordination with our medications, specifically levodopa. So with protein intake, it can decrease the absorption rate of levodopa. And so we want to space out that time of medication intake and then also protein intake.
So think about the protein. It's kind of a precarious thing. You've got to have it. You've got to get it in, but it can conflict with your medication and then cause it not to work as well. There are a couple of solutions that we've used in the past. One recommendation that is to delay your protein intake until the end of the day. I've yet to have much success with that because what happens is people don't eat protein all day, and at the end of the day, they're just tired, and it's hard to get all that protein in. Premier protein is a good solution for that. It's 30 grams and 8 ounces. So and it's only 160 calories. So that's a good option to get a high protein in. The other option is to time it with your medication, right? So just make sure you're eating moderate protein through the day, and then don't have it right when you take the medication. Give about an hour between the two. So you'll see that we'll have that balance today. Like, we gotta have protein. How much do we have? When do we have it? So that's always a concern.
We'll put that on per day.
Yes. It's 0.8 grams per kilogram of body weight per day. So that'll be your total amount of protein that you need in a day. The number of grams, probably around, I don't know, 50, 60, 70, depending on your weight. And then of those grams, it's math, about 28, 30 grams per ounce. So we'll come up for later on the math on the calculator. I'm going to embarrass myself if I try.
So you take the medication, or you have protein or after an hour. I know there's like an hour if you want to take the medication.
Yeah, so I would suggest take the protein before. Take the medication before. Right, and get it moving through the GI tract before you put the protein in.
Just taking it earlier in the morning is probably best, just to get it out of the way, and then the rest of the day you can focus on that dietary intake. Okay. Yeah, so definitely spacing it out with that time frame. Yeah, but it is a juggle. So, all right, and so next with fluid intake. So, kind of another recommendation: 1 milliliter per kilogram. So that just means if I'm taking in 2,000 calories per day, I want to take in 2,000 milliliters or 2 liters of fluid per day. And so, 6.
Yeah, we were.
Yeah.
No math on the spot.
Okay.
Yeah, we can figure it out. And so with fluid needs, the main concerns are dehydration, but also wanting to keep our organs lubricated, functioning properly, the actual transfer of nutrients. So throughout our body with our blood, making sure that everything gets transferred properly, but also having a healthy bowel system as well, with regularity and kind of preventing constipation kind of together. And also some different sources of fluid, again, besides water, sports drinks, energy drinks, but also milk, and then foods with high water content. So watermelon, melon, strawberries, anything like that will count towards our fluid goals for the day. And next, again, plenty of fluids in coordination with movement. So if, as I guess, Parkinson's does progress, if there is limited mobility, chair exercises, seated yoga can also be something that's an option, just to increase the amount of movement and help with the bowel function as well. And again, with fiber, so fiber is going to help us with bowel regularity. But whenever we increase our fiber content, we also want to increase fluid as well. So some common foods that we have here that would have fiber. So definitely fresh fruits and vegetables, corn, pretty much everything here would have fiber, but also whole grains as well. That would increase the fiber, yes.
Yes.
Yeah. I would say, we definitely want to have an adequate amount of fluid to help with any heart issues and also blood pressure. Yeah.
We really need to see you or do an assessment to let you know if there's too much or not enough, because there are times where there could be too much, but I don't know.
Yeah. And also just kind of like you mentioned, so with the fluid needs, every individual is different. And so it's not to say that, this is our recommendation specifically for you, but generally speaking, this is the recommendation.
This is generally speaking, but honestly, when I'm working with people, I know you've got a lot going on and a lot going on with food and water. Holding things can be difficult, getting it to the mouth can be difficult. Just watch the color of your urine. It should be the color of pale lemonade, and let that be your guide. That and your bowel movements, those should be regular. Let those be your guide. Don't count ounces. We'll put that energy towards something else. Oh, all right. Supplements. All right. So I told you I work in neurology, and not just with Parkinson's, but ALS, multiple sclerosis, myasthenia gravis, a lot of them. There's an industry online of preying on, I take it very personally, I think they're preying on neurology patients, but there's a lot of desperation in this field because there's not a lot of cures. So you're going to get hit with a ton of options for supplements. The ones I've got listed here are the ones that we have evidence for, that we know mostly will do something. But first, I've got to say, be careful with B6, because if you're on the medication, if you're on the carbidopa levodopa combo, then it's probably fine. This is sort of a less of a concern. If you're just taking levodopa, B6, pyridoxine is what it's called, will cause it to be metabolized in your peripheral nervous system instead of the central nervous system where you need it. And so I always warn people, first of all, if you're just taking levodopa, that's the only ones I'm concerned about. But I warn people to check your multivitamin formulation. If you're taking a B complex, look at that. You want to make sure it doesn't include additional B6. Vitamins B3 and B12 have been shown that they may slow some progression. They're certainly not going to hurt. Vitamin C is good for its anti-inflammatory properties, and there's some evidence showing that it could also help with your mobility and motor abilities. Vitamin D. This one is pretty popular, and a lot of people take it for improving Parkinson's symptoms. The evidence on that is not as strong, but one thing we know for sure is that it helps with bone strength and bone density. And so vitamin D taken along with calcium will help with minimizing long bone fractures, which is a problem in the Parkinson's population, especially if you have the risk of falling. If your mobility is impaired and you might trip and fall, then the last thing we want is a broken bone from that. CoQ10 probably has the least evidence on this list of things, but again, it's not going to hurt you. It has been shown, it might provide some protection from some of the inflammation and oxidative stress on your body. And then omega-3 fatty acids. We're going to be showing ways to work that into your diet as well as supplements, but fish oil is a pretty common supplement for its anti-inflammatory and brain health properties. And then as far as any other vitamins and minerals, there may be others that you need based on your own personal health situation. Maybe you need more or less vitamin D. Right now, a ton of people are vitamin D deficient, and I know it had to do with COVID and staying inside for so long, but if you're feeling tired, if you're feeling grouchy, you might just have that checked. Just that's aside. That has nothing to do with Parkinson's. And then there are other nutritional supplements that are not vitamins, minerals, herbs, that sort of thing. And I think she'll talk about them in a bit, but things like Boost, Ensure, Glucerna. So things that Kate Farms is a very popular one. And those are liquid supplements that can provide you additional nutrition when eating is difficult.
So continuing with independence and progression of Parkinson's with eating. So there are adaptive feeding devices that we have here towards the end. And these devices can be really useful as Parkinson's progresses for the patient so that they can continue to eat independently. And so with that, we just want to maintain the level of independence. And so some of the options that we have here, starting with drinking. So these can help with no spilling.
This is called a Frivoli cup. And this one, if you're choking when you drink, it will only allow, this one's 5 milliliters. So 5 milliliters at a time is all you can get. If one is 10, and that means you get evidence that is more than 10.
Yeah, that's correct.
And then this one is no spill. It's called a Kennedy cup, and it won't spill. It will drop a straw that real quick. There's this thing that goes down, and whenever you tip it over, it won't spill. This, does anybody want to guess what this is?
A napkin holder.
I don't have anything to really show you, but let's use our imaginations. Stick it onto your stove and put your top here, the handle through there, and it'll hold it for you, so you don't need to use 2 hands to stir something. Very minor convenience, but one that if the pot keeps spinning on you, that would be helpful. This is just a slack chop that not Parkinson specific, everybody has smoothly, but they're not there. You don't need as much dexterity with your hands to use a pencil. This is a fun one. So we're going to use these papers later, but this is a hands-free jar opener. You hold it on until it, see those things closing in on the lid. Once it finds the lid, I think you can let it go. Yeah. And then it will turn that and open it for you.
I want that.
Oh.
Everything's on Amazon. That's always my answer. But then also there are I don't know if that's anywhere else, but adaptive devices. I generally Google adaptive feeding devices and it goes on the website. This is another one. This opens cans. It's the same thing. You set it on and tell it go, and it spins around the can and it opens it for you. Can is free. All you have to do is push it. This fun thing is a plate pumper. Stick it on the back of a plate so that you can just push your utensil against it to scoop the food up. You don't have to. Again, these are very intricate movements that require more dexterity than people have. The weighted knife. There are also weighted utensils that help with the trimmer. You can bend them so that you don't have to twist your hand around. You can just sort of lift it up to your mouth like that. This is a spoon, knife, and there's a 4 part here. This is
Anything close to grabbing. Want this egg right here? You don't hold on. It has its work to do.
This one here, that is a great question. Actually, I had this the first. Yeah, I would say, yeah, depending on like the level of like manual dexterity, you're like having like this was grasping with, you didn't have the grass to be used, depending on how well you're able to grasp the device, right? Very not bad. So yeah, just like builds up quick here, where it's not as thin as a fork would be, as mentioned, it really just depends on if you're having different graphs with devices, as well as that plate guard right here, exactly right. Yeah, if you notice how I did how a layout of like how the plate would look. As the plate guard on there as tension, as well as the way the pencil. This is really just fix a guard on that. Along with positioning, I would say the meeting is probably the important thing is posture. That's where it all starts. Yes.
And then what this egg holder is a covered spoon that helps to hold the liquids in it as you're criminal. But y'all, this is the piece of response. This spoon actually counters your tremor and keeps it level for you as you feed yourself. It also has this bad boy right here. Like spaghetti, you say? And I had it tested it very much. So, a doctor I went with the other day put some water in this and bounced it around. It stayed in pretty well. I'm just going to say this though, they're $300. So I think it's cost prohibitive, but there's people getting it. Mhm. It also has an app that comes with it that will analyze your tremor and then send data up to the registry. And help the community as well. And then maybe a couple of other things. Alexis will use this whenever she. I don't have my finger on it. Yeah. This is called a rocker knife. It's so much easier than holding and doing this. You just do this. Get loose with it. Just rock on your wherever you're trying to pack. And then finally, when she makes these egg muffins, we've got this suction cup bowl holder. You can suction it to the countertop and put your bowl on it, and so now again you can only use one. Yeah, and easy. I mean, there are also weighted bowls that are really heavy that would hold themselves down. I don't really recommend those in neurology because you have fatigue and that's what they want. And feel free later to come up and put your hands on. This is a if you need dysphagia free, this pamphlet is a point you to a really good website. It's Hormel Health Labs. They've got a ton of like thickened drinks and texture modified foods that you can buy ready made, and you don't have to blend your own foods. You don't have to thicken your own drink. Hormel Health Labs. But you can look through. They have a really good ice cream called Magic Cups that it's high calorie, high protein, and when it melts, it's the consistency of pudding. So if you do have swallowing difficulties, it's not a thin liquid like most ice cream is. And it's a small amount. It's a half a cup, 290 calories, 9 grams of protein. So it's a small volume. If eating is difficult, then we want to get as small a volume as possible so that you don't have to sit there and swallow it. Oh, I left this one off. She'll use this too. This is the cutting board. You're going to use this pepper because you can just stick your pepper on it and then it'll hold it for you and you can cut through it that way. If you needed something, you could also do it here. And then it'll hold it for you so you can slice this way. Whatever. And it's also stuck into the counter.
Really cool stuff. So all of this kind of together should help with intake, but again, also just with independence as well. And so on the next slide, or the current slide right now, is just some of the images of the different devices that we did cover today. And then actually, while it's up, on the top right corner, that's kind of like a chicken shredder. So similar with this, the little spokes come out. You can put the chicken breast or any type of other food item on there. And with the handles, you can just move it and it'll shred the chicken for you.
I had a patient this week with ill-fitted dentures who used that for later. Talked about it really slow.
Okay, and so again, with intake, sometimes just even with aging, like Parkinson's aside, individuals might have difficulties with the mechanical digestion. So with chewing, swallowing as well, also known as dysphagia. And so with that, texture modifications might be necessary from a regular, let's just say bell pepper, to cutting it, mincing it, or even blending it as well might be necessary. And so with this, we can do these modifications to be able to enjoy our favorite foods. That's something that, we never want to take away, and that the person should be able to enjoy. And so also with moistening foods, that can help with dysphagia as well, with the swallowing and the ease of it without any pain or anything like that. And so you can do that by adding different creams, gravies, other condiments, ketchup, butter. And so that will kind of soften the texture and make it more palatable and easy as well. And then again, with liquid thickeners on the bottom is Thicket or Simply Thick. That's another one as well. And so if there's any dysphagia for fluids, This can basically, it's just a powder that you mix into a cup with the fluid, and so it can change the consistency of that drink or anything like that to something just a little thick, or it can be nectar thick or honey thick as well, as the individual needs. And then if there are any future concerns with swallowing or eating, a speech language pathologist can complete a swallow study for you. Yes.
This all looks wonderful, and I'm just a novice and trying to figure this out. If you have all these wonderful foods and you cannot swallow, how does it get from your mouth to your stomach? I mean, that's my question.
If you can't swallow at all, then
Well, so you can swallow, but that's what my question is. Is it not being able, it's difficult to swallow?
difficult. So sometimes people will say, when I swallow, I feel like the food sticks right here.
Okay.
Or
but they can actually
They,
physically.
there are a number of things that can be wrong with your swallow. There's several points of failure. Remember that these are also muscles. I work with an SLP who reminds me all the time, these are muscles. They get tired. At the end of the day, we find that our patients choke more in the evenings because they're tired. They've been talking all day. Saliva management, swallowing your saliva all day. You're swallowing dozens of times an hour, probably more. So your muscles get tired. They might get stuck. You may stick in the buccal folds. What we're trying to do is get you the foods that you can safely swallow. Yeah. And so the example that I like to think about a steak. So you just take a steak and cut it. That's a lot of chewing. It's a lot of chewing, and you probably don't chew it well enough before you swallow it. That's a big bolus going down your throat. But what about chopped steak? That's a little bit less effort for you once you put it in your mouth. But ground meat, that's ground beef. That's a whole lot less effort. And when food is damp with something, gravy, sauce, condiment, whatever, it goes down your throat a little easier. And so the added benefit of that is that ground beef will hold, or ground anything, has more surface area to hold that liquid, that moisturizing food. And then the addition of those liquids can very often be easy ways to add more calories without adding a bunch of volume to eat.
So the muscle still works, it's just more difficult.
Yeah, if it doesn't, then following a swallow study, the speech language pathologist is going to say you probably need to feed too.
Right.
That's the answer. If you can't swallow safely at all, then that's it.
And so on the first picture, the plates left to right. So on the left is just a normal plate with any texture modifications, and then slowly moving to either minced and moist or just simply pureed on the right-hand side. That might be necessary.
And the point of thickening the liquids is that it slows everything down. Gravity takes over even inside your body. So when you put a mouthful of water in your mouth, your tongue is doing work. You're just not realizing it because it's a reflex. If something's wrong with the muscle that it's not doing the work, then gravity is going to pull that water straight down into whatever is the path of least resistance. Thickening those drinks will make it so that whole process is much slower, and your muscles might be able to get a better grip on it. There are also things that are naturally thick, like milkshakes, and Boost is pretty thick. Some people just choose, whole milk, and that'll be thick enough for them. It's not that thick, but it's a little bit thicker, all the way up to something like a milkshake.
All right, and so with early satiety or the feeling of fullness early on in the eating event, we want to consume higher calories earlier in the daytime. So again, with what Tad was saying, over time and throughout the day, with eating or any talking, the muscles within our neck can get tired. And so when we consume the higher calories in breakfast or lunch, that means we're going to get the adequate amount of energy that we need versus having a larger meal towards the end of the day when we're feeling tired and maybe only consume 25 or 50% of that meal, if that makes sense. So consumption of those higher calories meals or snacks throughout the day, preferably earlier in the day, and also not filling up on fluids. So if we're going out to a restaurant, we have a really nice drink. It's tempting to drink it right away, but also that liquid is going to fill up our stomach, and then we're going to not consume as much energy or food in that process. So we recommend drinking fluids, sipping on fluids after your meals, and in between as well. And so finger foods can also be really helpful. Anything that's with higher calories can be useful. Just having those nearby. So for example, cheese and crackers, any dried fruit, carrot sticks, and hummus are good options.
But soaking chicken strips, like there's anything, and it also makes it easier just to get to your mouth. You know, if you're not having to deal with cutting and fork and all of that. So finger foods are a good way to go.
And so just with aging in general, weight maintenance is a concern. And so adequate consumption of meals. So we want to consume a good portion or a good percentage of those meals. And so if our appetite or consumption is less than 50% of meals, you might want to consult with a registered dietitian about managing or preventing weight loss. And again, with high calorie snacks, nut butters, avocado, butter, cheese, those foods that have a higher content of fat in a smaller volume will help with weight management and just adequate intake of energy. And so choosing full fat dairy can be an option. And then again, with oral nutrition support supplements, some different liquids can be, 12 ounces, but have 300 to 400 calories. Yes, ma'am.
Is soy milk okay?
Soy milk is fine.
It's okay.
Not great.
It doesn't have much nutrition in it. It doesn't have much calorie in it.
Okay.
I mean, it depends on what your needs are. I tend to push people toward cow's milk if they can drink it. If you can't, then don't. But
We were on a diet right for your time, and one of the things was to avoid dairy. And that's when I went to soy milk. So what's saying about that?
you would ask her that. I'm not on the anti-dairy bandwagon at all.
No, I'm not either.
And I I think that to remove dairy from your diet
Right.
for no great reason, like an allergen, you're removing a protein source, phosphorus, potassium, B vitamins, there's a ton of nutrition in there that you're just not going to get elsewhere.
And having Parkinson, so you're supposed to avoid butter and cheese, yes or no?
Well, you want to limit your unhealthy fats,
All right.
but you can't get through the wall without
Right, no, kidding.
And who would want to?
Opposite of need a drink if this is true.
No, I think that the goal there is to sort of limit our saturated fats
Okay,
and animal fats. And honestly, everyone should be doing that.
Okay.
I think we're good.
Oh, did you have a question? I saw your hand come up.
No, actually,
Sorry.
In the back there, yes.
All right. Okay. So next, we're actually going to move on to the demo portion. So first, we have the egg and vegetable muffins. If not, they can be packed out. Okay, so first, with these, so we have eggs, spinach leaves, grilled bell peppers, frozen corn, and cherry tomatoes. So really the options with these recipes that why we chose them is that they can be very modifiable. So if you want to add more protein, you can add chicken as well, or some salmon. And so also with fiber, again, these are really great options. But it's really modifiable for what you do. So I'm gonna get started.
You can also buy these already chopped. So we won't be eating these ones. I may not cut these as small as I would otherwise. And like Alexis was saying, these recipes you can add to. If you need to, these egg muffins are what I would consider as moderate protein. There's one egg each or so. But if you need calories, then you can add salad cream or whatever you like, cheese. You can choose any heavy cream. That's a really good calorie source if you need it. You can also add things like we've got smoked salmon here you can put on top. That's a very healthy fat that you should be having a couple times a week anyway. With that, capers is always good. That's just for flavor. Look at a lot of it. Sour cream. I tend to think sour cream goes in everything, or it could, and so
Can you add cheese?
oh yeah, you can add bacon, you can add anything you like that will fit inside that can. In fact, we have a study going right now where we're preparing food for people and studying their phosphorus intake and its relationship to hypertension, and they're using these same recipes, but they're adding bacon and dairy and that sort of thing to get more. Yeah. It's quarter though, right?
You can leave out the red bell pepper, right?
Yeah, you can leave out anything you want, but you can also add spinach or anything that you like. The idea too, we talk about anti-inflammation. Anti-inflammatory foods are going to be, think vegetables and fruits and colors, lots of colors. If you don't like red bell pepper, then use tomatoes. If you don't like that, use cook some carrots and put in there. And if you don't like the bell peppers, if they're too firm, and the ones that you'll try today, then cook them before you put them in. You know, soften them up before. And you don't have to use a skillet in this pan. You can throw them in the microwave for a minute or 45 seconds. What did I see? Something that we're cooking now in the microwave. Tortillas. I saw someone throw a microwave. Tortilla in the microwave, a full tortilla for 30 seconds, and it turns into a chip.
You put it around on wet paper towel.
That's how I do it. I mean, sometimes I'll just heat the stove up and just do this with my hands, but. All right, so where are you going? Can you scoop the honey in? Yep. I can't move it. I got it.
So yeah, pretty much just mixing everything in here. And then just stirring.
This recipe makes, it sets it up for 4, but depending on how much you put in it and much more fillings, you may stretch that out further. There's no way to mess this up. I mean, you put it all in a bowl. Yeah. Like the ones that they made for you, I think, are in cups.
Yeah.
So you'll have something. And then they only cook for what, 8 minutes or something like that. It's a very short period of time. The recipe card should have the nutrition labels on it as well. So, yeah, per the recipe, it's 110 calories each. That's not that much. You can have 2. You know, it's also a finger food, so you can pick it up and eat it with your hand if you need to. So,
Yeah. Adding whatever you like to your preference. And so the next thing would be the chocolate avocado mousse. So this recipe provides 4 servings with 220 calories. And so this contains 2 large avocados, honey, vanilla bean extract, and also cocoa butter. And so we're going to be using a food processor. If you don't have a food processor, a blender also works just fine as well. Just might need to blend it a little bit longer.
So is this like a dessert or?
It can be dessert, yeah, or a snack as well. Yeah.
So it's called a mousse, but it's really, it's avocado. It's avocado with cocoa. But avocado is a healthy fat. It's one of those omega-3s that we talked about earlier. So this is a very anti-inflammatory dessert. Also high in calories, if you need calories.
What's the liquid you're about to add?
It's a vanilla extract. Yeah. So it's just 1 teaspoon. And just 3 tablespoons of honey.
You can measure that honey with your heart if you need to, though. You could also, you don't have to use honey. You can use sugar, agave nectar. You can use any sweetener that you like. If you don't want to use any of that, you can use Splenda. It doesn't matter. You just don't want avocado and cocoa with nothing sweet. I saw this week someone sent me a video of someone making a pudding out of boiled eggs. It was boiled eggs, cocoa, and sugar, and I don't never needed pudding. Nothing about that sounded good. It sounded like it smelled good.
So then the last ingredient is just 4 tablespoons of cocoa powder.
I don't know, it looks like.
We're gonna find out. Might be loud. Oh.
Wow. Wow.
Moderation.
The least salt you can eat is best, but I would do that.
See if you have low blood pressure. Not yet.
Do it. Ketchup, I'm fine with that. Gravy.
I like a little orange.
Hot sauce. Tend to put hot sauce on the most things.
It's a little chunky. So
So we can go ahead and pass these out. This is what it's going to come out like.
I think even topping this, we have strawberries and blueberries on top, but any type of nuts, pistachios, I think would be really tasty as well.
Wait there.
Sweet enough?
This is pretty good. I get it.
Yeah.
I've never seen a combination of cocoa powder and
Keep in mind you're eating avocado. There's a lot of calories in that. I was at a conference once and there was this ice cream that's like the one I was telling you about that's super high calorie ice cream, and I'm just standing there talking to the guy eating it a minute ago, and he's like, "Yeah, it's 500 calories a cup." Whoa, 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 whoa! Like, so just know that's avocado.
So yeah, I'm glad that you'll enjoy that. This one's still a little bit chunky, but I think okay, and so lastly, we have a berry smoothie. Again, very modifiable. So in this one, we only have coconut water, frozen strawberries, blueberries, and Greek yogurt. I personally really like to add spinach. I'm a green smoothie person. So again, super modifiable.
I should measure these first because I don't know how much they have.
Okay. So it says a half cup, but
We're gonna make extra rich.
Extra.
what are your thoughts on like cashew yogurt versus Greek yogurt, or is it nutritionally?
So people tend to move to the alternative yogurts whenever they're allergic to dairy, to milk. I have to look at the label. It used to be that I could talk about yogurts very easily, but if you look at the wall of yogurt, and recently there's a billion kinds. I've sort of focused on my brand and my one, but you know, you look at the nutrition label. I tell people this all the time. Just grab the two that you're wondering about and compare them like this. You know, and consider protein to be a positive nutrient. You want that to be high. Sodium is a negative nutrient. You want that to be low. And that's the way I would compare. I think you're going to get more. I know that there was a dietitian here in town who contacted what's the almond company, Blue Diamond, is that what they're called? That's all good. And a cup of almond milk has the nutrition of 6 almonds in it. So That's not much. Nut butters though are going to be very high in calorie. They're going to be just as much as peanut butter. Well, I mean, any recipe?
specific kind of yogurt?
So I really start with Greek yogurt because it's the highest protein content. The Yoplait that I grew up with, I kind of think of as grown-up pudding now. Like there's 4 grams of protein in it. It's just not that much. Most Greek yogurts are going to have anywhere from 9 to 15 grams, depending on what it is. The higher that protein is, the more concentrated and less water there's going to be in it. So it's going to be tart, a little tangier. This dietitian is not mad at you for getting the kind that has some fruit in it. Like I'm perfectly fine with a little sugar. It helps that medicine go down.
What about carbohydrates? Carbs, in other words.
What do you mean?
You want lower, you want to get temperatures lower.
You want moderate. If you're diabetic and you've got a whole different situation with carbohydrates, then you're going to want to look at them and stick to your diabetic diet. I mean, however many carbs you're supposed to get, that's how many you get. Which is why we talked about adding calories to things with fat sources. Healthy fats when you can, those are going to be, think about it like this. A gram of a carbohydrate is 4 calories. A gram of protein is 4 calories, but a gram of fat is 9. So you can eat much less fat and still get more calories. It's just more efficient. And if you're eating these healthy fats in that instance, then what's the harm?
Back to yogurt.
Yes, sir.
A lot of them say Greek yogurt, but they're not. There's actually a Greek yogurt.
There are Greek brands for sure, and any of them are fine. What I've found with yogurt is it's so personal. Some people just cannot stand the tartness. You kind of get the one that you like. But my determiner is how much protein is in it. I really like Noosa, but that's basically ice cream. I mean, it's just dessert.
What was the name of it?
Noosa, don't get it. It's delicious. It's addictive too. But, there are also Icelandic yogurts. In all of those cases, I would just look at the nutrition label and look for a high protein.
All right.
You can open up water. Not to get water and just use yogurt because it's more nutritious, thinned out. This one. You could also substitute instead of yogurt or water, you could use like a Boost or Ensure or one of those if you need to get more calories and you're just tired of chocolate and vanilla. Here, come on here.
So besides what you're showing today, is there a menu book, recipe book?
Parkinson's Foundation is where I would go. They've got a ton of this stuff. In all of my neurology practice, I tend to send people to whatever disease foundation because they've got people looking at the research, they're summarizing and organizing it for you, and they're putting where diet affects it. They will have a diet and nutrition area.
The last page of the PowerPoint actually has a few links for different online resources.
Yeah, and the last one listed on there is drugs.com. And because drug interactions are the biggest kind of nutrition concern that we have with Parkinson's, I always tend to tell people to go out to drugs.com on their interaction checker, list all your medications. If there's some supplement that you've considered, somebody said elderberry would be good, put that in and see if it conflicts with any of your medications. There will probably be interactions that you can ignore. They have them kind of tagged as red, yellow, and green. So like red is bad, green is don't worry about it, and yellow is I mostly worry about the reds. If it's bad, it's going to be red. So feel free to look at those. And what were the other ones? Parkinson's Foundation was one.
Parkinson's Association.
We've had some great collaboration with the Parkinson's Foundation, both nationally and their Southwest conference. In fact, Anubis sits on one of their boards, many boards. So the thing that we do know about the Parkinson's Foundation not speaking about any others, is that they have a pretty robust team of physicians and clinical providers that do a lot of research, a lot of literature review. They're pretty rigorous about what they publish in that particular group. So, and of course, some of you may see Dr. Bill Bauer, who is the director of the OBI. Bill is a neurologist by training, is a researcher, but his specialty is Parkinson's, and he often refers his patients to the Parkinson's Foundation website for information. So.
Are they tasting?
Right.
And that smoothies, I mean, we gave you a recipe, but smoothies are really what you have in your fridge. I mean, anything can go in there. And like she said, you can throw spinach, kale, any sort of leafy green in there, and it's probably going to be overpowered by everything else and not affect the flavor. You could put avocado in it. It might make it ugly, but it will add calories, change the texture, and add a lot of healthy fat for you.
Peanut butter.
Peanut butter, all it's good. Peanut butter does everything. Everything.